All right, hello everyone. Today we have our healthcare webinar. We're just going to give it a few minutes for everyone to join and then we'll get kicked off. Okay, so my name is Justin. I'm a trainer here at ClickUp and I'll be taking the webinar today. Today we're going to be going over various applications in healthcare. Now before we kind of get started, just as a few more people are joining, I just want to point out some housekeeping things. So first of all, I'm going to launch a poll right now just to help us understand where you're coming from in terms of what your role is, whether you're medical, admin, et cetera, et cetera. If you could look at the bottom of your screen, there should be a poll section and answer those. That'll help me choose which kind of, I guess, perspective is really useful and what people are coming from. And I'll make sure that I adapt the content to make sure we're kind of hitting that. So that would be awesome. At the bottom of your screen, there's also a Q&A section, which has where you can ask questions. And we have Sophia on the line, who'll be moderating questions throughout the webinar. We'll try and answer as many of those as we can. If your question doesn't get answered, then there will also be, at any time, you can contact our support via chat here. Awesome. There's also a chat functionality. We won't be answering questions in there, but if you do want to just chat, discuss things with each other, that is there as well. And this is being recorded and will be available to watch again. It will be available at clickup.com/webinar. Awesome. So it looks like we have a lot of people who are marking the other in the poll. If you could chuck what you would designate yourself as in chat, that would also be really, really interesting. Just so I have a good understanding of kind of who I'm talking to. Okay, so we've got some project managers, some executive assistants. Cool. Okay, awesome, awesome. So it looks like we've got a lot of people on today from the either managerial or project management director style perspective, as well as a range of others. So cool. We'll make sure we're keeping that in mind. All right, now jumping into the webinar today, we just get a question of how long is this webinar? Typically they run kind of like 30 minutes of content and then we open up for questions afterwards. So we'll go for a maximum of 1 hour, depending on how many questions there are. Great. So in general, when people think of healthcare and kind of using a platform, a system for that, people often think of medical records and patient tracking. Now, large-scale organizations will typically have an application for this, either an EMR or an EHR designed specifically for that. But ClickUp can work for that for maybe smaller organizations or solo practitioners. I would just suggest checking out clickup.com/security just to make sure that our encryption, et cetera, meets your local government requirements for storing patient data. We do have a plan that's HIPAA compliant. Just contact us if you do need a BAA. Okay, that is kind of only part of what ClickUp can be used for in the healthcare industry though. Healthcare operations of any type really tend to have a lot of moving parts, and organization and transparency are critical to avoid getting things wrong. So some examples of non-medical use cases of ClickUp are kind of administration of all types. I have in mind particularly, service managers overseeing multiple services, organizing all the moving pieces, project management, obviously, and then also staffing and shifts, scheduling, clinical rotations, supply of inventory and reordering, training and onboarding of staff, tech and equipment tracking, either where it currently is, when it's last been serviced, any damage reports, etc. Hospital SOPs and compliance checklists, booking transport, room booking, completion checklists, and even storing documentation. So I'll go through some of these later in the webinar, but just to give you a brief idea of what ClickUp is as a functionality. My mother is a nurse. She had a really great explanation of what ClickUp is, which I thought was brilliant. So there's the 5 rights of medication, and she described ClickUp as the 5 rights of work organization. So it's making sure that the right people are doing the right tasks at the right time, in the right order, with the right process. So in ClickUp, all of that is easy for each person to see without having to go searching for information. You always kind of see just what you want to in a view. So ClickUp can be used for very complex setups, but often there's kind of great value in keeping things simple. So today I'm just going to go through some very simple, helpful use cases that I think will be perhaps effective to get started quickly. So the aim here is to create a simple and intuitive system to make everything happen easily. There's a huge amount of knowledge required in all facets of healthcare, and you really don't need to learn another super complex program. If you have an EMR, you probably already have had to learn one. So let's aim to have the system be simple, work itself, and run smoothly, with each person getting the information they need and having it be easy to enter their information that other people will need to see, and getting automatic reminders to make sure it all happens. So I'm also a big fan of checklists as a way to guarantee remembrance of process. I know the healthcare industry is already way ahead on that with surgery checklists and others. So I'll show you how that can be easily done in ClickUp as well. So without further ado, our first use case that I wanted to show you is just this appointment booking one. So in ClickUp, the basic building block is a task, and you can simply create a new one. It's just got a name, and this is what allows you to create a work item. Now, it could be something to get done, but it could also be, in this case, an appointment, a patient, a room, whatever it needs to be to organize something in ClickUp. Within our task, we have who it's assigned to, so we know the right person is doing the work. It's got the name, the description. If this task is a one-off, or often we have repeating ones as well, so you can write in the instructions here in kind of a text type format. We've also got subtasks and checklists. Now, if you're running through like a standard process, you'd probably create a checklist here. And then once you've kind of created it, you can save it so that anytime you need to use that process again, you can just dump it right in. We have attachments for any files, either that need to be given to the person doing the task, or the person who's doing the task might upload them as they go. And on the right, there's conversation. So here you can collaborate on tasks. If you perhaps need to get in advice from several people, you can mention them and then ask for some advice on whatever you need to, maybe ask for something else to get done, or just report on the progress of the task. So we'll say, can I get your input here? So in our appointment booking list here, basically what I'm thinking is this might be useful for a small practitioner who has people coming in every day and wants to make sure that they're all, the system's staying organized. So each task represents a person. It's assigned to whoever will be seeing them, whether that be a doctor, a masseuse, a chiropractor, anything else. Due date I'll use as the date of the appointment. And so here I've also added a time. So I picked the day first and then added a specific time, which would be useful to see. Then I've created a custom field. So we have all of our columns over here. These are the default ones that you can kind of, they're currently hidden, but they exist, so we can just put them in, or we can create new ones. So I've used a drop-down custom field and called it appointment type, and then given it a few values. So we have initial checkup therapy. I've kept it very, very basic. Obviously, you would have specifics for your industry. So for the initial meeting, this person's having an initial meeting, whereas Amanda's just having a checkup. And we can simply pick for each one. Cool. Now, because we've given them due dates, we can also show it on a calendar, which can be really helpful. So let's just find some next week that we're showing. So let's jump along to next week. And we'll see, we can see the various times in the calendar here. Now, this initial appointment is currently only 30 minutes. Probably that will be more like 90 minutes. So we'll just drag that to be larger. We can also just drag and drop to move things around on the calendar as well if we wish. Cool. There's also a bunch of other settings you can do in here. I won't go through them too much today, but just know that you can kind of customize it to work a little bit more like the way you want. If you want to, see certain things on the task cards, or show weekends, not show weekends, that sort of thing. Lastly, I've got a form, and so this allows anyone outside of ClickUp, they don't have to have a ClickUp account, to fill in this form, and it will create a task. So here I've got different fields. This field is the task name, and I've just renamed the kind of the heading for that field to be name, so people know what to enter. In the task description, I've asked them to give us other information, and then I've added the start date with the appointment time, and the appointment type as appointment type. Cool. You can also rename the submit button and the thank you message if you wish. So when we view that form, we'll get a nice little form here that people can use to book an appointment. So you could embed this on your website, you could email it to people, however you want to distribute it. We'll put in some information. Hopefully they're more descriptive than this. And then we'll book a time. Let's say 3 p.m. And we'll say it's an initial appointment. So once we hit submit, they get the thank you message. You can redirect them if you like. That's one of the more advanced features. And then we'll have it pop up as a task on our list. Now we need to assign a person. Now actually, I was previously using due date, but I have switched to using start date instead, which is why that's not showing up. So there we go, we've got our Wednesday 3 p.m. And we might say that Amy's going to be the one seeing this person. Awesome. Okay, next up I wanted to show you some case management style workflows. So here a task is perhaps a person we're working with. Actually, one thing I'll point out before I go on is statuses. So here I've just got very simple statuses. I've got future appointments, appointments that are cancelled, and then appointments that are complete. I haven't put in an in progress status because typically most people won't change the status, while they're in the appointment. It'll either be before or afterwards that you're kind of editing it. So with our case management, we have slightly different statuses. So we have new, working with, and complete. Because you're typically working with a person for some time, you'll be in that status. Now these are fully editable. So if you do have a more complex process with many more steps, that's totally fine. You can go in and edit list statuses here and make as many different statuses as you wish and give them different colors, etc. So here are some other ones. Cool. Okay, so the assignee here is the caseworker, the person that's going to be working with them. The start date just gives us an idea of when this person first came to see us. And we could use a due date if we are expecting them to leave our case management at a certain point. So for example, for Angelica, we've been working with her for a while. We kind of know when she's going to be leaving. Phil's new, so we're not sure yet, so that's empty. We can also add a comments column, and this just gives us a quick link to any comments. We can quickly enter a new comment here, and we can also see any existing comments on the task and reply to them. So those will live here. Cool. Now, in terms of case management, you're typically doing a lot of kind of back and forth, a lot of work. You probably use comments a lot to collaborate between people who need to have input, maybe just take notes and keep up to date on what's happening, make it all kind of follow process and be sufficiently documented. If you do then have outcomes that you're looking for this person, you can create subtasks and kind of work on each individual outcome. And that has its own areas, so you can have its own assignee, its own description, its own comments. So it's just a way of kind of dividing it up so you can kind of focus in on each thing and have all the information that you need recorded. All right, next up, I want to talk a little bit about staffing. So the first thing I've got here, so one thing I should cover quickly is the structure of ClickUp. So currently I've been looking in different lists, and lists house tasks. but lists live in these spaces. So they're kind of just big level organizations of many lists. And you can see you can also have folders. So a folder is just a way of grouping together multiple lists, and lists house tasks. That's the basic structure. If you do want to see things from multiple spaces at once, you can also go up to the everything level, and you'll see all of your lists and tasks in ClickUp. That can be very useful if you do want to then filter down to specific things. So you can kind of pull from anywhere, but filter to just certain types. So for example, you could say, I only want to see tasks where the due date is overdue, for example. And you'll see those results from all spaces within ClickUp. Okay, so we'll jump into our directory here. And you'd use this to kind of keep a list of all of your employees and perhaps make it easy for anyone to contact the right person. Oftentimes within any sort of healthcare organization, you need to make sure to make a referral, find out some information, just contact people, and you want to be able to do that quickly without having to go through a lot of barriers or take a lot of time finding that information. So here we've got a bunch of employees, and I've given each one a custom field, which is department. And I've then grouped by that department. So instead of grouping by status, like we saw earlier, this one's grouped by custom field department. So we can see everyone in obstetrics is grouped together, everyone in surgery grouped together, radiology, admin. You may have many more departments than this. I just kind of tried to pick some really basic ones. Now, each person has a different status. Now, statuses are just basically their personal status. Are they working, sick, on leave, on rotation, or a past employee, in which case they'll be hidden. They've also got a title. Again, I've just picked some very basic ones. I've got nurse, doctor, and surgeon, and director. But you may have, more specific, or you will probably have a more specific structure that you can enter there. Then we just have their phone number, email, and their working hours to make it easy for them to get in contact with. If you did want to search for someone, you can just start typing in their name up here. So that can be helpful for staying in contact. In terms of scheduling shifts, there's a bunch of different ways to organize this, just depending on how many people you're trying to schedule over how much time. For example, you could just have each task be a day and then have multiple columns for the shifts, and you can simply add an assignee to each column. So that would be using the people column. However, in this case, I'm kind of assuming that we might have more than, say 10 shifts, in which case there'd be too many columns, it would get frustrating. So instead, what I've done is I've created each task as a day. So I've got May 1st and May 2nd, and then I've given them subtasks, and the subtasks are the different shifts. So here we can see who's assigned on this day, and then what type of shift they're doing, if it's an early shift or a late shift. Now you can see I can click on this to expand or collapse subtasks, but I can also just go up here to subtasks and make them permanently expanded. Now there's quite a bit of, creation in creating multiple shifts within this parent task. So what I could do, instead of just making a new task and then filling all that out again, I can simply click here and go duplicate. And then I'll give it the next name, which is May 3rd, and then copy. And we'll see here, it'll pop up with the same information, the same structure. You can also save this as a template. So if we were to open this task, we can go save as template, and that would simply allow us to use it anywhere again as well. So let's do that actually. Let's go schedule day. That's what we'll call the template. We'll save everything. And then we want to go to make a new task. We can't use the quick create button here. It doesn't have a template functionality. So we'll just use the plus button in the bottom instead. So we'll go new task, and we'll go templates, load from template, and what do we call it? Schedule day. Cool. And then we have to give it the name. So in this case, we want to call it May 4th, 2020, and create task. And we'll see it's popped up there. Now we did save everything, including the assignees, so it has pre-populated them. We may choose not to save the assignees or even the custom field values. just so it's kind of blank and easy, ready to go. Cool. And then we can, of course, see in a calendar all of our different shifts. So I've currently got the word shift filtered for, so it's going to only pull in those subtasks and not the parent task, which doesn't have the word shift in the name. Okay, so if we go to next week, okay, so we've got the first there, which has dates entered in, and we can see we've got shift 1, 2, 3, 4, and 5. Now I've actually got 2 listings there, I think because I didn't change my due dates. Here we go, we've got May 1st, May 2nd, May 1st, May 2nd again. So what we'll do to fix that is we'll go expand subtasks. Now we'll save this so it stays expanded. And then we can simply select all of these tasks. So I'll select the first one, hold down shift and select the last one. Now these ones I want to change all to the 3rd of May. So I'll go to the calendar here and select the 3rd of May. And that will change all of them. Dismiss that selection and then select the next ones and make these the 4th of May. Done. Cool. And now our calendar will make a little bit more sense. So we can see we have shifts on this day and who they're assigned to, the next day, and I'm skipping the weekends. That's why the 2nd and 3rd are not there. So for example, if I were to show weekends, you'd then see the Saturday and Sunday as well. Cool. So I've chosen to display assignees there just to make it helpful. So we've got assignee on, and I'm also coloring the tasks by custom field. And I'm using the type custom field. So you can see by the color, if I just reload that, that these ones are early, these ones are late shifts. So depending on how your scheduling works, everyone kind of does it a little bit differently. You can kind of create a structure that allows you to simply enter the information and then kind of see it visualized. And then if someone wants to switch their shifts, they might say, you can even do a custom field for like wanting to switch their shift, so anyone looking to can see who else would like to, or what can be done. But you could also just tag someone and say, hey, are you willing to change shifts with this one? And then if so, you can just switch the assignees. So it can be very flexible. Okay, next up we've got supply, inventory, and reordering. So the way I've got this list set up is simply I've got a task for each type of item. And I've got some duplicates there because they're in different locations. So I've got bandages in the storeroom, I've got a maximum capacity and the current stock, and then I've got bandages in the surgery with maximum capacity and current stock. So it's just helpful to kind of keep up to date on what the total levels are, and then you can reorder as soon as they hit a certain level, or just move them from the storeroom out to wherever they need to be. So for example, these IV bags, they're getting quite low. So we've assigned it to Willow and given it a due date to remedy that, either moving some out from the storeroom or ordering more. Now this might be a good place to kind of add a doc view to have some processes around, what levels constitute too low, what the reordering process is. We could have multiple pages for each of those things. Oops, bad spelling. Just so that people have a quick access to the information they need to remedy the situation. And I might even have a task in here that's kind of separate from the rest that says check stock. And then I could make that recur, maybe once a week or maybe even once a day, actually. Let's go recurring daily, including weekends, yeah. And we'll hit save. So that will pop up every day, and we might assign that to one, or if you turn multiple assignees on, you have it assigned to multiple people. In my case, I'm not actually going to do that because I'll have those type of tasks in my compliance and completion checklists. So I'll keep this just for inventory. Cool. Okay, next up, training and onboarding of staff. So we do this a lot internally at ClickUp because obviously, no matter what your company is, you still need to train staff. So I've got this onboarding and training folder here. And in this, I'd use it to group together lists where each list is an employee. So for example, I've got a new employee here, Grant, who I'll click on him and see his tasks. Now, I've made some tasks here, just some really basic ones. What you'd typically do, instead of making tasks for each new employee, which would be very time consuming. It should just template this whole list. So if I go to the 3 dots beside the name of the list itself, and then go save as template. And this will allow me to save it. So you can see I've already got some here. And then anytime I want to, actually I will save it, we'll say new employee training. Cool, I'll save everything. And anytime we have a new employee, we can simply go create list from template, select our list name, and then the name of the new employee. So maybe this is Sarah. We can remap the due dates, which just means it's all going to be brought forward to start from when she starts, and would enter that date in here. So this should be the date that we want the first item to be due. Now, in this case, I don't have due dates, so I'm just going to ignore that. Create list. And now I've got all my tasks for Sarah. So for example, if you had 50, 100 tasks that new employees need to step through, that's a very quick way of replicating that for each new employee. And then as they go through, they can simply check these off. There's a tick mark here rather than the normal statuses. The reason for that is that there's only 2 statuses on this list. There's to do and complete. And if you only have 2 statuses, it enables this check mark capacity. If they have questions about it, they can type them in here, mention someone to get help. And you may have instructions about exactly, learn our software is not a great description. So you might have the steps, subtasks for the set stages, checklists for things to try out. You can have a whole lot of information in there as well. Awesome. On the folder level, you might even want to have some different views just to kind of see how people are going. For example, box view might be good. It gives you an idea of how many tasks each person is assigned. So you have a box for each person. Currently you only have 1 because everything is unassigned. And you'll see how many tasks are done and not done, the percentage, and then what those tasks are. So you can get a quick overview of kind of where each person's training is at, which might be handy. Okay, so next is SOPs, compliance checklists, and tasks. Now, I've got a compliance checklist here. So this is kind of things we might want to repeat every day. So I've just got the tasks. Within check stock levels, I've got a checklist of the various places that we need to remember to check. You can create multiple checklists for the various parts of the process for getting it done. I've got the person who needs to do it. And then I've also got an recurrence. So this one recurs every day. So that when it gets checked, it'll then pop back up again for the next day. So there we go, it's now due tomorrow. Now, it can be a little bit annoying if you did have a large list of these. You kind of don't want to see the ones that are due tomorrow. So what you might do is create another view, and you could use any type, but I quite like list views. So I'll just make another list view. And now it kind of goes into a little drop down here. I'm actually going to rename it to say today's tasks. And then I'm going to filter to only see tasks that are due today. Actually, I might do today and earlier. So any task that's due today or is overdue. Now I'll save that. As you can see here, these are just the tasks that need to get done today. So we'll go through, check them all off. Once this is empty, then we're done for today. And tomorrow, new tasks will pop back up because they're recurring. So this is looking at the exact same tasks that this view is looking at. It's just got different settings on them, basically. So that's all our views are. You can have as many list views as you like, and each one can have different settings to look at the tasks in a different way. The settings are filtering, which changes what you see, grouping, which changes how the groups are laid out. An example of one where we have groups is here. So we've got a group for this status, a group for this status, whereas you could change that to only show them in one group, for example. Then we've got subtasks that you saw before, expanding, hiding them. You can also make them totally separate so they can be filtered on separately. We've got me mode and the people sidebar. It's just a quick way to see only your own tasks or only the tasks for a certain person. So for example, if you're staring at a list of 100 tasks, you can click just me and then only see the ones that are assigned to you, which can be very helpful. And then we've got the settings in here. Cool. Another thing that'd be very helpful for SOPs and checklists is our docs feature that you saw before. So you can create a doc here. We also have a doc home section, which gathers together all of the documents on your workspace that you have access to. And we kind of divide them between ones where you have a comment assigned to you, ones that were shared with you, and ones that are just private to you. So for example, you could then create a new doc and have all of your SOPs in here, and it doesn't need to be kind of attached to a location within your hierarchy. Cool. Within docs, I mean, most people have used some sort of documentation type system before. So it's all your basic things. You've got formatting up here, headings, bold, etc. Some highlighting, some different types. One, I guess, key thing would be you've got bullet points there, as well as numbered checklists, and then also checklists. So checklists, a lot of documentation types don't have, and they're very handy. Whoops, daisy. So they allow you to create a checklist and then literally tick it off. So you typically use this if it was kind of a one-time checklist. If you wanted to use this repetitively, you'd put it on a task and make it recurring. But it's good to know that it's there. And there's a few other options here as well. So within a doc, you can have pages, and then pages can have sub-pages. So you might have 10 top-level pages, and then pages within each of those, and you can go down to I think it's 5 levels. So we've got 3 there. This is 4, and then I think there's one more, 5. So you can have this really deep trees of information. So if you imagine you have 2 to 3 documents at each level, you can end up storing a lot of information in here. Okay, the last one I wanted to show before we jump to questions is booking transport. So in a lot of applications, this won't matter, but for example, hospitals do a lot of booking transport. So here you can simply create a new task, give it the name of the person who needs to be transported, where they're going. So you have, to home, to another ward, to an appointment, or to another hospital. And so that is again a drop-down custom field type. We've got the date of the transfer. We could assign it to someone if we have the person driving as part of the company. For example, it's a company employee driving. If it were linking out to an outside service, we probably wouldn't use that. And then the address to transport to. So it's just a simple way for one person who's coordinating all the transport to see everything that's happening all in one place. And then we've got a form to make it really simple for people throughout the hospital to quickly submit a transport request without having to call a person, go through a whole bunch of steps. It can be really, really simple. So here, if we view this form, all they need to do is enter the patient name, pickup time, the type, and where to transfer to. Now you might want to add their number if you do need to do some communication to talk about details. So you might want to have the doctor's number or whatever their extension is. But in general, it's a really quick way to make the process, initialize the process in such a way that you have an item to be able to see and organize it later on to keep things really well, running really well. Okay, so that is a bit of an overview of a whole bunch of different types of administration that can be done in ClickUp for healthcare industries. Now, we do have a lot of managers on the line, so I wasn't going to, but I might actually just jump into dashboards as well. So dashboards are a feature we have that's really helpful for seeing overviews of data. So for example, let's go into a business management one. So we've got different types of charts, and each of these charts, you can simply select a location. So that can be a number of spaces, folders, or lists to pull those tasks in from, and then group by something. So you can kind of show the different colors by statuses, by tags, assignees, priorities, or a range of custom fields. You can choose to value them based on the number of tasks by a custom field. For example, you might want to see the amount of money that something costs, or just the number of stock you have. Yeah, some people will use time estimates if you are doing the more project management style use case. And then you can get some good kind of overviews here. So you can kind of see here, I've got the statuses of all my different tasks to try and see, how much, what percentage of things are done versus in progress versus not started. The current priority of different tasks. We want to make sure that we're not getting too far in the red. The task division between different people, what tags are being used the most, which may indicate that we have a lot of a certain type of issue, and then a line chart. This one's for sales. So I've got a whole bunch of different dashboards here, and you can make as many as you like for different types of reporting. I think I've actually archived the list that this one's based off of, but you can also get an overview of projects to quickly see what the status is, what the progress completion is, and then if you're doing time tracking, that's there as well. So that can be a really good feature. Okay, I'm going to jump into questions now. If you do have any use case that wasn't covered today, do just chuck it in the questions, and if I can go over it, I'll try and make sure I do. Awesome. So first question, my organization has 13 case managers and coaches. However, only 2 to 3 work with each client. Okay. If I set up my space so each client is a task, would this allow for only 2 to 3 case managers to view and access the case? Or is this only possible if each client is a separate list? Okay, good question. So that's around permissions. So we have permissions at each level. So by default, tasks, lists, folders, and spaces are all public. So anyone who's a member will automatically get access to them. Guests will not. However, you can choose any of those items and make them private. So for example, you could go into the sharing settings of a list and make it private, but you can also do it with a task. Sharing permissions, what am I doing? Here we go, make private. And then you can kind of add the specific people who should have access to it. Now, I'm just thinking, you could do it by task, that might be fine. If you do have the same 2 to 3 case managers who all work with like a set of clients, you could make a list for just them. But if it's kind of lots of crossover, so you know, 2 will work with one client together, but then they each work with someone else on another client and someone else on another client, and it's kind of all over the place, then yeah, it might work best to do it by just by task. Cool. Awesome. Next question is, in the transport request, is it possible to do a lookup of patient name? Not yet. So lookup fields are kind of like a relational functionality, one that we're thinking about implementing, but currently you can't look up information in a different list as like a custom field. You can link them. So for example, if you had a task somewhere else that had you know, the name of the customer, sorry, the patient's details, you can link them together. I think actually I have it off in this space, so I'll just quickly turn it on. So I'm going to go into my space settings here, and ClickUps are features that can be turned on and off. So I've got these ones off. I'm forgetting something. I hate when I do that on webinars. So what we want to do is we want to create a dependency, which often appears here if you've already got one. There we go, dependencies. I'm blind. Cool. So you can either make it be waiting on another task, blocking another task. That's kind of the project management style applications, but you can also just link it to another task. For example, if you had the patient somewhere else, you can link it to them. Now it's not going to pull in information, but it will kind of give it you an easy way to get to that patient. In the future, we may be able to display information in the columns directly from that patient, but not just yet. Cool. Next question is, I want to organize each of my projects in ClickUp under different programs. Under different programs. Okay, so it's kind of talking about a hierarchy. Okay. So what you might do is have spaces for the different programs, and then you might have folders within them for the different projects. What I'd typically ask is, how big are the projects? You know, if the projects are each huge and they need to have multiple levels within them, then you might think about something like making the projects the spaces and just coloring them the same to kind of show which ones are grouped as a program. But normally a project isn't that big. So if you make a folder, let's just do this for a second, call it project. And then you can have an unlimited number of lists within there. So typically that will be enough space, and then each list has, you know, unlimited number of, sorry, not an unlimited number of lists, maximum of 400, which is a heck of a lot. but you can have unlimited number of tasks within each of those lists, and then each task can have unlimited subtasks. So typically that's enough space. Some people will just do a list as a project instead because they don't need quite so much levels of hierarchy, but that's typically how I'd organize it, kind of the program at a higher level and the project at then a lower level. Okay, next question is, I want to generate every month a highlight report of each project to the program board, which should include what status each project is in. Yep, great. So we do that, but we do it in real time. So you could kind of look at it every month and then maybe show it to the board, but it will update constantly. So it'll always be up to date. So the way we do that is with a dashboard, and we might just create a new one here actually, and call it highlight report. And the key, so we've got widgets, and these kind of like the different pieces of reporting that you can kind of put multiple together into one dashboard. The key one for this will be portfolio, and this will give us a high level view of different folders and lists. So you might have all of your projects here, maybe they're lists. So we might go into practice and add a couple of different lists that are projects. We can show subtasks, archive tasks, and closed tasks if we wish. We might show closed actually. And then we'll go add widget. And this will give us the name. We can use a list color. So this is where you might go the status of the overall project. So I'll also add a column for statuses, so we can see the statuses the various tasks are in, which can be helpful. But overall as a color, maybe this one is complete, this one is in progress, this one is not started. And right now these are just colors, but you can also give them names if you like. So we'll give this one in progress, this one complete. Cool. So that sort of thing. We can also see how many tasks are done, then completed, how many are overdue, the start date or end date of the entire list, if we've assigned it one, the priority and owner of the entire list, and then there's a few other fields. You can make a calculation, and then your kind of time estimate, time logs, etc. So that's the main one. Oftentimes, just to make it pretty, I like to add some charts to highlight different elements of these projects. But if you just wanted to do this, you could simply expand that and just have a list of all your projects. Okay, next question. I have resources sitting under different teams who might be working toward my project. Okay, I'm not quite sure what the question is there. I assume it's around resource management, and it sounds like resources might be technology, rooms, or something like that. Okay, so what I'd probably do there is create a list where each item is a resource, whatever they may be. We could even do each item as a booking, and then have a drop-down list for the different resources. I might need more information there as to what the end goal is. I assume you want to see, where it's being used when, to make sure it's all being coordinated. Yeah, but if you maybe give us some more information, that would be great. Okay, next question. The project managers want to see what tasks are assigned to the team members by other project managers. Interesting. So we have each task has some metadata. For example, who created the task. You obviously have the comments. There is not a field for the person who made the assignment. However, actually you can see it within the task itself. So if you were to open up any task and look at the activity, you can see this was assigned to Sophia, and it will say who. So in this case, it was me, but if it was another project manager, you would see their name. Now you can't filter on that. So the easiest, if you need to kind of see it at a high level altogether and kind of quickly filter on it, the easiest way would be to have it so that perhaps you have your projects as lists, and then there are other projects. So you'd assume that tasks that have been assigned by other project managers are in the other project managers lists. So then you could say, go to the top level, whatever it might be. I might go to the space, then filter for location. and then just choose the locations that are not your projects. So then you have all the other project managers' locations, and then you would look at the people sidebar for your people and see, okay, these are the tasks they have that have been signed outside of my projects. So it's just the key issue is, how do I tell whether it's my type of task or someone else's? If they're all mixed in together, it does get quite tricky. You can see on an individual basis, but if you want to see kind of a high level view and pull them all together, it's good to have some sort of indicator as to who assigned it. And you could, create a custom field for that. Say, the who assigned it. Say assigner, and then they can mark themselves down if it was really important. Yeah, it feels like a little bit of work to me to always do that, but if it was necessary, then great, do it. Okay, can forms be custom branded? Good question. So we do have a branding option. However, the design of it is to remove the ClickUp branding. So if we go into view form, I think this is available on the business plan. We have this little productivity by ClickUp here. This picture can be changed. So what you'd probably do is turn off the ClickUp branding and then remove, well, I mean, you won't have it to start with, put your own logo on here. I don't think I have another one available on my computer at the moment. And then you could have your form look like that. So perhaps you have your picture here, you have a color scheme which suits your logo and company colors. So for example, we can change it to blue instead. And then if we refresh this one, you've got blue, submit button, and asterisks. So yeah, you can brand it, I guess. You can have your logo here and the colors. Okay, next one. When scheduling people for shifts, how can we set up a conflict warning? For example, if that person is on PTO, but we try to schedule them for a shift, ClickUp would alert us of a conflict on that date. So you're starting to get into functionality around very specific scheduling software. We are kind of like a flexible, anyone can use it for anything type software. So you're not going to get that specific a functionality. You could, however, devise a system for that. So we go into our schedule here. So the easiest way would be to have a second list with paid time off, and then at the folder level, which will kind of allow you to see both lists, you might have a calendar, and then when you go through and schedule, you might just check on each person and say, okay, what do they look like? And if they ever have 2 tasks in one day, you can tell that there's a double up. So they might have one task for PTO and then another task for a shift. And you go, well, that's not going to work. So that's the way of doing it visually. In terms of an automatic warning, what you could, I'm trying to think if you can do this with automation. So we have automation here that has a kind of trigger, like if something happens, then do something. And you could do something like, I typically use add a comment. It might be like, this person is on PTO, they can't take this shift. And then you would get a notification from that because you're a watcher on this task. The question is, how do we trigger that? We want to know information from somewhere else. I think perhaps that's not going to work. Yeah, the trigger needs to be on the task itself. And because you're kind of creating the new task without knowledge of their PTO, it's unlikely you're going to enter anything that would trigger that. So yeah, checking on the calendar is probably the best option, having the 2 lists. There may be a better way, but it might take me a while to think of it. Okay, next question. If you utilize docs for SOPs, it will not show up in your space, but in the documents tab, is that correct? Both and either or. So for example, you can have it show up on as a view and also in the docs home. It will always appear in the docs home. It can optionally appear as a view. So for example, I might have it appear on this list or on the folder or on the space. But regardless, it'll always appear in the docs home. So this is a gathering of all tasks, of all docs, but they don't have to be in a location. For example, this one's on inventory. And these three actually don't have a location currently, but I could add one. Doesn't everyone need to be HIPAA compliant to do the healthcare online? If they are storing patient information and they are in the US, then yes, they likely do need to be. Obviously, different countries have different compliances, and a lot of people use ClickUp for admin functionalities only, so they're not storing client information. In that case, they wouldn't need it. But yeah, if you're storing client information and you're in the US, very likely you need a HIPAA compliance. For the highlight report, is it possible to do it on a as per date? For example, the last of the month. I'm not totally sure I understand as per date. So you want to see it like what it looked like on a certain date? I think the answer there is no. We do have a lot of reporting that you can select a date range. For the portfolio widget, it's always just up to date. It shows the current state. So if you looked at it on the end of the month, you'd see it as it is there. But if you try and look back in history, that's not going to work as well. If you did need to do that, you could perhaps use other widgets instead. For example, you could do a line chart of statuses from your selected locations. Let's just get all of those, and then you can give it a time range. So you might say we want to see the last month, so that we have the end of the month visible. And we have task group by status, sure. Now this is not going to appear because that list didn't appear last month. That's annoying. Okay, let's change those settings to be this month instead. What's the date? 24th of April. So let's say that today is the end of the month. It'd be 23rd of April for everyone in the US. And then you can kind of see your statuses at the end of the month there. I like to stack these to make them a little bit cleaner to see. And so you can kind of see different statuses. So, graphs are a different way of interacting with information compared to this. So that I'm not totally sure if how useful that's going to be. But if you do want to see just a section of time in the past, a number of widgets do that, just not this specific one. Do you have resource leveling for assignees over multiple lists? Not yet. That's a feature that's being worked on. So, well, I guess there is kind of a feature for that. The box view that I mentioned earlier, that allows you to see all of your people and how many tasks they have assigned. And you can base that on the number of tasks, the time estimate of those tasks, or if you're doing agile, you might have a points system. So that allows you to kind of balance between people. You can drag a task from one person to another person to balance the load. It is designed for that. The only thing is it's more of like a total. It's looking at how much total and complete work do you have right now, rather than how much are you going to do on this day versus this day. So what we have that's coming soon is the ability to do the same thing, but also divide it up by days. Cool. So I think that's the end of our questions there. If you do have any more, shoot them through. Otherwise, we'll finish the webinar in a couple of minutes. Awesome. All right. Well, I hope that was really helpful for everyone. If you do have any questions, further questions, always do know that you can reach us at support here. Just click on the chat functionality. Yeah, and I hope that ClickUp is being really useful for you. We look forward to seeing you in another webinar. All right, have a great day.